Welcome to Black Women's Health Podcast. I'm Dr. Rahman. This is the time of year where we usually have to choose our health plans for the coming year. Question: what did you base your choice on? Was it the provider? Was it the hospital? Or was it the cost of the health insurance plan? Today, I'd like to talk about three healthcare models which we have in this country: the traditional insurance based healthcare model, concierge, and the direct patient care healthcare model. You may ask, why? Well, the reason is a change is happening in this country. You need to be aware it can affect you and someone you love. The traditional insurance based healthcare model has been around the longest. Starting post World War II, employers in the US started offering health insurance as an employee benefit. The employer paid the premiums to the insurance company, and the insurance company would pay the doctors and the hospitals for any service or care provided to the employee. Wonderful. However, as the cost of healthcare increased in this country, the insurance premiums increased, and employers started sharing the high cost of health insurance with the employees. This has resulted in our very complex system, which includes copays, deductibles, coinsurances, prior authorizations, pre certifications, in and out of network providers. For providers, it's a hassle. It has increased bureaucracy and decreased reimbursement. For patients, it's a hassle. It has increased dissatisfaction and increased costs. With this backdrop, a second healthcare model emerged: the concierge healthcare model. In this model, the patient pays the physician a retainer fee. The fee usually ranges between to thousands of dollars per year. In exchange, the physician provides comprehensive primary care services, 24/7 access to the physician, longer appointment times, personalized wellness and treatment plans. Think white glove service, resulting in happier, probably healthier patients, less stressed physician. The problem, it's not affordable for many. Some have argued it creates a two-tier health system: the haves and the have-nots, which leads us to the third healthcare model, direct patient care, which has become increasingly more prevalent. In this model, the patient pays the doctor or provider a set amount each year or month. That amount ranges between $50 to $150 per year per person. Like the concierge practice, no insurance is involved. Like the concierge model, the focus is on primary care services. Like the concierge model, the patient tends to report less hassle and more time spent with the provider. Unlike the concierge model, there's less access and less amenities, but compared to the concierge and the traditional insurance, direct patient care model is less expensive. Less money, less hassle, same or better care. What's the catch with the direct patient care model? The catch is this: the direct care patient model only provides primary care services. And what exactly are primary care services? These services include the type of things that you go to your PCP or your internist or your family practice for, such as diabetes, cancer screening, annual wellness checkup, management of long-term conditions such as asthma, high blood pressure, and some gynecological service such as pap smears. What the primary care services do not provide is specialty care: seeing the cardiologist, seeing the dermatologist, seeing the gynecologist, hospital care, emergency room care. These services would then either have to be paid for out of pocket, which is a prohibitive expense for most of us, or the person would have to have had insurance to provide coverage for those services if they were needed. So you understand me. Even if you are using a direct care patient model and you pay a provider directly for primary care services, you will still need insurance. Yes, you will need insurance to cover specialty care, hospital care, emergency room care in the event that it is needed. Who will provide that insurance? Will it be your employer? And if so, will you have deductions and premiums to pay like before? Or will you get this insurance from outside of your place of employment? These are all very interesting questions which have to be decided on an individual basis, considering what makes sense for you and your family, what provides the best level of care that you can financially afford. Consider the following three scenarios. Single mom, fixed income with two children. One child has asthma. Mom would like a direct care plan because it's cheap. However, she's on Medicaid, and most direct care patient providers are not currently accepting Medicaid or Medicare. However, these models are constantly evolving, and she would be advised to speak directly with the direct care patient provider to see if that's true for her. Scenario number two, professional woman with symptomatic fibroids, otherwise well. She may choose concierge care because of her time constraints, and she knows that her doctor will help her in deciding her options and offering referrals in the management of her fibroids. And the third scenario, family, mom, dad, two kids. Kids are healthy, mom has high blood pressure. They could potentially save money with a direct care patient model and a high deductible insurance. And so it varies from person to person, family to family. The bottom line is you have to consider health history, current health condition, financial condition when making your decisions. We are truly witnessing a reworking of healthcare in the US. Stay tuned.